Hi, my name is Dominick Valdez, and I'm a first-year medical student. I plan on becoming an OBGYN. That's short for obstetrics and gynecologist. And so essentially I would be working with female patients or patients who have female genitalia. I am actually the middle child of 9, so I have 4 older siblings and 4 younger siblings. For me specifically, I wanted to go into the field because of my mother. Growing up, she had some difficulties with her ovaries, which made it a little bit difficult for her to conceive children. But she's always wanted a very big family, and there were times when I would wake up in the middle of the night. Well, I was woken up by my dad in the middle of the night to take me to the hospital, take me and my sister to the hospital to kind of see what was going on with my mother. And more often than not, it was likely because she was having a miscarriage and they needed to go to the hospital. And it was getting to see her interact with her doctors and getting to speak with them and actually figuring out what the OB/GYN letters on their coats meant, which drove me into kind of looking a little bit more into the field and figuring out what it is I could contribute to that. Since there were so many siblings, I kind of had a hard time discovering myself. I am someone who has been diagnosed with major depressive disorder and generalized anxiety disorder. At least when I became conscious of it, was probably earliest age around 9. It went away or suppressed itself somehow when I started high school and didn't really come back until maybe my sophomore year of undergrad. And I don't know if maybe that just because just the stress triggered everything again. Losing my grandmothers, both of them. College is hard as it is, but dealing with that on top of learning how to take care of yourself mentally was really different because I think a lot of people don't necessarily know that they're going through something. And so you have to make sure you're feeding yourself, make sure you're making your own schedule. You have to make your own doctor's appointments if your parents are making them for you. Just figuring out how to kind of who I was in relation to everyone else, and then learning to be okay with that. Before medical school started, I was actually very anxious. You work so hard and you do all of the studying and preparing for years to finally get that acceptance letter. Honestly, I cried. It was just a wave of relief that came over me. Medical school is a time commitment, so you're pretty much spending all of your waking hours studying. I tend to wake up around 5 a.m. That's not the average for most people. I do that just because it allows me to finish studying a lot earlier than it would normally. I don't pull all-nighters ever. That's just not healthy. I also really like my sleep. I study in what are very brief intervals of high intensity, 25 minutes on, maybe 5 minutes off, and I'll do that in about 4 cycles. After that 4th one, I'll take a half-hour break, an hour break, do whatever I need to. And that's pretty much my everyday routine. I try to keep it pretty consistent. And it's not that the material's particularly challenging, it's just that there's so much of it. You're not necessarily gonna be able to see your friends as much as you like. You're not gonna be able to spend time with a significant other if you have one. Your life is medical school for the most part. That whole time commitment aspect is definitely something that a lot of people might not be used to. You're gonna have to put in a lot more effort than you did ever before. I just think about all the people that I can potentially be helping, specifically as a person of color going into the field. There's not too many physicians as it is, but particularly in the field of obstetrics and gynecology, the US has one of the highest mortality rates in the world, despite being one of the most well-developed countries. I think about being able to help people like my mother who do struggle with having children, being able to work towards reducing the US mortality rate, especially that for people of color, because they're 3 to 4 times more likely to experience challenges in either the pre-birth period, the postpartum period, or even during pregnancy. I just want to be able to work towards that goal. And knowing that I've worked so hard to get here, I gotta put every effort into it. I'm sure I've missed out on a ton of opportunities simply because I didn't go for them. Either because I didn't think I was good enough for them, or because I was just too afraid to do it. And honestly, you get 0% of the opportunities you don't go for. shoot your shot. My name is Dominick Valdez, and I'm a first-year medical student.